Big milestone in a child's life, of course, that being teething. But what are parents supposed to do when kids start losing their baby teeth? Dr. Brian Dunlap of Dunlap Dental joining us now to talk about this kind of a period in a kid's life and what parents are supposed to do. And a lot more should be said than actually is when it comes to baby teeth, losing them, and what should happen after that.
Right. You know, I think a lot of people think because they're baby teeth, we're going to lose them. You know, we don't need to worry about them. They get a big cavity in them or something like that. But you got to remember, a lot of these baby teeth are going to be around till the child is 12 years old. And so that's a long time. And so if you lose a tooth too early, in other words, if there's a tooth that's supposed to be in there till they're 12 and you lose it when you're 7, then there's a space there that becomes a problem because teeth will start shifting and moving around, and then it's going to create problems for the adult teeth that are supposed to come behind. So, you know, it's important to be taking care of these baby teeth just like you would the permanent teeth.
You've got to kind of prepare the area.
That's exactly right. That's exactly right. And so about when they lose the teeth, you know, that's another thing. So kids will start losing teeth usually around age 6. Some a little earlier, some a little later, and it really doesn't matter. Should
we let them fall out naturally, or should we take them in and see guys like you and have them take it out?
You know, we see all types, and it really, I don't think it matters that much. I see kids that as soon as they're loose, they'll work them and get them out of there. And I see other ones that are literally flapping in the breeze because they will not touch them until they fall on their own. And, you know, it really doesn't matter that much either way. Unless it's causing the child discomfort, then, you know, go ahead and get the tooth out. But, you know, no, you know, real protocol there.
How about when the other teeth start coming in?
Well, when the other teeth start coming in, now that's really important. At 6 years old, you're going to get your set of 4 6-year-old molars, your first molars. And it's very, very important to see the dentist as soon as those comes in and get those sealed, because those in the grooves of the adult teeth are where you're going to see most cavities in the back. Kids are not great about brushing back there because they're new and they usually haven't had teeth that far back. Yeah, adults too, that's exactly right. But, you know, so they're not used to brushing back there, and it's real easy in those deep grooves of those adult teeth to get decay. So we try to seal those as soon as they come in, and then at 12 years old, they'll get another set of molars. You get those sealed up, it's amazing how much work you prevent in the future.
How about for flossing for kids?
You know,
is it as important for kids as it is for adults?
Well, you know, I think it's important. I wouldn't say it's quite as important because a lot of times in kids, they have natural little spaces between their teeth. And so they're not going to have as many problems as adults. Now, I'm not saying it's not important. It is. But, you know, most kids, if you look, they have little spaces between their teeth. And by the way, I've had a lot of parents ask me, I've got a lot of spaces in here. Is that a problem? It's actually a good thing. Your adult teeth are so much larger. If your teeth are all perfectly together in their baby teeth, you can bet you're probably going to need some orthodontics. Yeah, so it's a good when you have the spaces. But, you know, we do recommend when the back teeth are tight to help them start flossing when they get to be about 5 or 6. And they'll start getting dexterous enough to be able to do it themselves when they get a little bit older. But you're going to have to help them out for quite a while.
When it comes to, and this may be just a thing that some parents do or don't do, but when it comes to kids when they're young, when it comes to whitening their teeth or perhaps veneers and things like that,
yeah, we don't really do a whole lot of cosmetics on kids. I mean, you know, really until, probably don't even worry about anything like that until we're looking at teenagers. And even then, you've got to be careful on how you implement that.
Even if younger kids have some teeth that may look discolored?
Well, like I mean, every case is different, and it just depends on what's going on. If you do have some problems with some baby teeth, you know, you're going to lose these front baby teeth by the time they're 5, 6, or 7. So usually not a huge deal there. You know, they're going to lose them early and get those adult teeth in. But, you know, you do have adult teeth by the time you're 6 or 7. So, yeah, 6, 7, 8, 9 years old, if they got some problems there, we can do some little things, some bonding and things. And a lot of times you can fix discolorations with that as opposed to your normal bleaching or some serious veneers or something like that.
And it's always important to, you know, give you guys a call if you've got a question about anything.
Always. That's exactly right. Always ask your dentist if you're worried about something, you see something you don't know what's going on, or especially if the child is having discomfort. Please call your dentist.
And the key is not, I guess, treating cavities, but preventing them.
That's always easier and less expensive. And less expensive, I promise you.